Hello everyone, welcome to today's lesson with Caleb Mlonga. Today we are going to look at a condition, a nursing care plan for a condition or a patient with tracheostomy tube. So before we even go into that, let us first define what tracheostomy is. Tracheostomy, this is a surgical procedure in which a stoma or an opening is made on the throat or the neck, in which an opening or stoma is made on the neck between the third and the fourth tracheal ring. In this opening, a tube is inserted to establish breathing or to facilitate ventilation. So in this procedure, basically what we're doing in surgery is that we are going to create a hole in the neck, and this hole is called a stoma, and a tube will be inserted to help the patient to breathe. So this can happen in patients with severe burns of the neck, the face. This can happen in cancers of the throat, the larynx. This can also happen in patients who are very sick or unconscious for a long period of time. So these are conditions that can facilitate such. Those are the indications. So having that background, let us now look at a patient with a tracheostomy tube, this tube that has been inserted. So quickly, let's look at the nursing care plan. So this tracheostomy nursing care for a patient with a tracheostomy tube will be in two parts. The first part will be 5 problems. The second part will also be 5 problems. So we tried to exhaust all the problems. So quickly, let us start. The first problem is ineffective airway clearance. So as you can see, in a patient who has a tracheostomy tube inserted through their throat, what would happen is that it will be very difficult for them to remove those secretions in the airway, because as the secretion are accumulating, they will not be forcibly or willingly be removed through the tube by the patient. They would need external help. Therefore, the secretions will accumulate in the throat. So the nursing diagnosis: ineffective airway clearance related to accumulation of secretions secondary to placement of tracheostomy tube, as evidenced by difficulty in breathing. So as you can see, the ineffective airway clearance is as a result of the patient being unable to remove these secretions that are accumulating in the airway. So our goal, basically, the patient will maintain a patent airway and normal respiration within 30 minutes of my nursing intervention. So always remember, this goals are SMART. Interventions: I will monitor the respiratory rate, depth, oxygen saturations, and skin color regularly for baseline data. So here we've just clustered everything up, but you can separate them where you look at the respiratory rate and the depth by itself for baseline data. You can also monitor oxygen saturations using a pulse oximeter to determine if the patient has less than 90% of oxygen saturations and administer supplemental oxygen. Number 2, I'll assess the breathing sounds for presence of secretions. So you might find that because of presence of secretions in the airway, the patient's breathing sounds will be forceful, as if the air is passing through an area that has an obstruction. Number 3, elevate the head of the patient to semi-Fowler's position to promote lung expansion. So that is a clear point where we're simply saying put the patient in a semi-Fowler's position as long as they are unconscious rather. Number 4, promote tracheostomy suctioning. Perform tracheostomy suctioning using sterile technique as needed to remove secretions. Number 5, which is a bonus, encourage fluid intake if patient is fully awake to soften the secretions, therefore facilitate removal of the secretions. Evaluation. Patient maintained clear airway evidenced by absence of cyanosis or respiratory distress and a normal respiratory rate of 18 breaths per minute. So that is B, breaths per minute. So that is all on ineffective airway clearance. So if you have any points, add them to the comment section, or if you have any questions. Let us move to the next one, which is impaired verbal communication. Impaired verbal communication. So you understand that because there is a throat, the tube in the throat, you will find that there will be difficulty for air to reach the larynx. So the way it works, for sound to be produced, air has to reach the larynx. So because there are difficulties, or there will be difficulties for air to reach that side because of this surgical incision and the tracheostomy tube, the patient will be unable to communicate, or their verbal communication will not be accurate. Diagnosis: impaired verbal communication related to inability to speak secondary to surgical procedure of tracheostomy, evidenced by patient struggling to speak. Go. Patient will demonstrate effective alternative methods of communication within 24 hours. So basically on the go, we are just saying that the patient will be able to communicate in other methods of communication within 24 hours. So it can be within 24 hours, it can be throughout hospitalization, because this is not a 1 hour thing. You can't teach someone how to perform some form of sign language within 1 hour. You can't do that. Okay. Interventions. Number 1, I will reassure the patient that the voice loss may be temporal to allay anxiety and impart knowledge. Number 2, I will provide a pen and paper or a communication board to facilitate communication. So this one is a very simple one. We give a patient a pen and a paper or a board, a small board for them to communicate. They can write and communicate. Number 3, I will encourage the patient to use sign language or gestures to enable communication or to communicate to others. Number 4, I will advise the to rest the voice till able to speak, to avoid straining the vocal cords, therefore feathering, or therefore causing more damage. Okay, we can also provide things such as a communication bell. Those are rare, but they are common and they can be found, especially in countries or hospitals that are in countries that are a bit more developed. The sixth one, although it's a bonus question, which is a bonus point, which is I will ask the patient close-ended questions to ensure or enhance easy communication. So closed-ended questions, these are questions that require one-word answers. For example, I ask you, do you want food? That is yes or no. So the patient will not be straining to try and talk. Evaluation: impaired verbal communication. So on evaluation, we're saying the patient successfully communicated communicated their needs using alternative communication methods evidenced by effective use of sign language and writing on a piece of paper for communication. We move to the third one. So we understand that if the patient is in this surgical procedure and this tracheostomy is there for an extended period of time, it can lead to altered nutrition less than body requirement. Why? Number one, it is because the patient will not be able to take anything orally. Number two, it can also be as a result of pain. So we have to understand that in this patient, there will be problems in relation to nutrition. Nursing diagnosis: altered nutrition, less than body requirement, related to inability to take inability to take oral feeds, secondary to surgical intervention, evidenced by loss of weight. So we are simply saying inability to take oral feeds, and this is secondary to the surgical intervention, or you can say the tracheostomy. Goal. What is the goal? Patient will maintain adequate nutritional status during hospitalization. Interventions: number one, I will monitor the body weight daily for baseline data or to note any anomalies. Number two, I will maintain intravenous fluids as prescribed for nutrition and hydration. Number three, I will administer a nasogastric feeding tube as ordered if for feeding to improve the nutritional status. Number four, I will encourage adequate fluid intake for 2 to 3 liters daily if allowed for hydration and loosen the secretions. Number five, I will educate the patient on the importance of adequate nutrition for healing. I know there is a temptation as nurses to include points such as foods rich in proteins for healing, food rich in vitamins for improvement of the immune system. Those are okay and they can be added, especially points such as soft foods. Okay, those can be added if the patient can be tolerated. But here I have kept them for another problem. Evaluation: patient maintained stable weight and adequate nutrition intake evidenced by a stable weight. So basically we're saying the patient has maintained an adequate nutritional status evidenced by a stable health weight. So you can put however you want it to be there. The fourth one, knowledge deficit. I know this is a favorite for a lot of people and they love it because it is simple and straightforward together with anxiety. So it is one of the problems, actual problems. So we are saying knowledge deficit related to tracheostomy care and surgical outcome evidenced by patient being agitated or frustrated or confused. So here I refrained from using patient asking too many questions for a simple reason. This patient is having a tracheostomy and we do not want the patient to speak as much. So if you are going to write asking too many questions, it shouldn't be verbal. Remember, we've spoken about other ways of communication such as sign language and use of a board, writing down. So that is the way the patient will communicate. So the patient can ask too many questions, yes, but since the patient is unable to communicate, you can also see the lack of knowledge through things such as agitation, frustration, confusion, Why? Because the patient is not able to understand what is going on. Go. Patient will have an understanding of tracheostomy care before discharge. So that is very clear. Number 1, interventions. I will explain the surgical procedure and the expected outcome to impart knowledge. So this is straightforward. Basically, we're saying we're going to explain the surgical procedure, what was done, and what is expected, the expected outcome or the outcome of the surgical procedure to impart knowledge. Number 2, I will inform the patient that breathing will occur through the tracheostomy tube rather than the nose to impart knowledge. This is very important. The patient needs to know that they will be breathing through a tube and not through the nose. Number 3, teach the patient and the family proper tracheostomy care to impart knowledge. Number 4, I will encourage the patient and the family to ask questions, and I will clarify any doubts to impart knowledge. Evaluation. Patient demonstrates understanding of tracheostomy. So you can say tracheostomy care, tracheostomy surgical procedure, evidenced by patient appearing calm and not agitated or confused about tracheostomy. So you can even say patient not asking too many questions. You can do that, but remember, keep in mind that here we are refraining from verbal communication because we want the patient to heal and they will be unable to speak. Okay, let us look at the last 2 questions. We also have disturbed body image. So if you look at yourself as beautiful, as handsome as you are, you do not have any tube on the neck. So because of that insertion of a tube and a stoma, creation of a stoma and insertion of a tube on the neck, it alters or disturbs the body image, the way you look, the way the good Lord created you. So this patient will have a problem in nursing which we call a disturbed body image. Nursing diagnosis: disturbed body image related to presence of tracheostomy, stoma, and tube are evidenced by verbalization about alteration to the neck by the presence of the tracheostomy tube. So the patient can verbalize, but remember, the patient can communicate to you. Rather than saying verbalization, you can say evidenced by the patient communicating about being uncomfortable with the presence of the tracheostomy on the neck or the appearance of the tracheostomy on the neck. Expected outcome or goal: patient will verbalize acceptance of body changes and demonstrate positive coping strategies throughout hospitalization. Nursing interventions: encourage patients to express feelings about altered appearance to allay anxiety and promote acceptance. That is the key. Here we want to promote acceptance. Number 2, I will suggest use of scarves or high collars or cleavers, clothes to cover the stoma if desired, to prevent people looking or seeing the stoma. So they can put up clothes with high collars so that they can hide, or they can put scarves, or they can put other things with high, where the clothes are high enough to cover the neck. Number 3, I will encourage interaction with other patients with similar conditions for support. That is very clear. Number 4, I will provide emotional support and reassurance to the patient to promote acceptance. So this is also very important, because if you are constantly providing counseling, emotional support, assurance to this patient, they will eventually accept, or you are helping them to reach a point where they can accept their situation. Evaluation. Patient verbalizes acceptance of body changes evidenced by improved self-esteem and coping with altered body image. So that is how we are going to evaluate this patient. Last but not the least, for our first problem, our first part of the video, which is risk for infection. So risk for infection related to the surgical wound and tracheostomy stoma. Go. Patient will remain free from signs and symptoms of infection throughout hospitalization. Interventions. I will monitor the temperature to rule out infection. So that is very important in the patient. We have to monitor infection, because infection can be symbolized by a rise in temperature, fever basically. Number 2, I will observe the stoma site for swelling, redness, or discharge, which can indicate infection. So this is done to rule out infection. Number 3, I will maintain aseptic techniques during dressing changes and suctioning to prevent infection. Number 4, I will administer prescribed antibiotics for prophylaxis. So this is done to prevent infection. Number 5, which is a bonus, I will encourage regular mouth care, and adequate fluid intake to prevent infection. Evaluation. Patient remained free from infection, evidenced by patient being afebrile, meaning not being with a fever, with a clean stoma site and no signs of infection. So that is how we are going to evaluate our patient. So if you look at the 6 problems that we've mentioned here, we only have one risk. And on the first one, which is ineffective airway clearance, this is a very important, and prioritization of these problems are particularly very important. So that one is the first problem that should show up, and in the interventions, remember to always put suctioning of secretions, because that is very important. Okay, thank you for watching. God bless you. See you in the next video.